What specifically has been going on in the design of prostheses in the last, well, however long you've been involved in it? Then?
It's over 20 years, although obviously I started when I was very young. But I thought I'd just get it in. The knee surgery and knee replacement has been a great pain relieving operation since the 1970s. And I think what's refocused us, and I think what you'll see and what the viewers here will know, is that we're changing quite a lot in our demands for knee surgery. So in the 70s and 80s, we were quite grateful to be out of pain and be able to sleep at night and walk a little bit. I think our patients now are asking a lot more. And the drive for design in knee surgery is functionality. How can we make their artificial knees more functional? How can we make the patients better in terms of their activity?
What about durability? Because patients are having knees replaced earlier, I think, now than maybe years ago, because instead of just replacing it because you couldn't stand the pain any longer, people will be having their knees replaced so they can enjoy better function. And yet we've still got, what, 10 or 15 years life in a knee? So
it's actually, well, there's a double whammy here. You're absolutely right, and people are told to wait as long as possible for their knee replacement because, and the background story was that because we wanted the knee replacement to last longer than they would. And if you could tough it out to 75 and you had 15 years of your knee replacement, chances are that would be the only operation you would need. I think, unfortunately, that's not going to work anymore because the double whammy is that not only are our patients getting younger in that they won't tolerate waiting till they're 75, these guys are 55 and they're in pain. So waiting 20 years for a knee replacement is not what they're going to do. So you're absolutely right, we're asking our implants to last longer. The 55-year-old is a golfer. He likes walking, he's got dogs, he wants to carry on. So they're much more active than a 75-year-old. So, for instance, a 55-year-old will take 6 times as many steps per year than a 75-year-old. They'll go upstairs much more often. So we're looking at the twin challenge of making the implants last longer, but also it's a higher level of activity over a longer period of time.